I'm Dr. Matt Russell, the Clinical Director of Geriatric Medicine here at the Massachusetts General Hospital. And I am thrilled that we are hosting a town hall on climate change and to help ensure a better future. Before I get to introducing our keynote speaker, I did just want to do a little reminder of some of the housekeeping with a Zoom call. As a reminder, everyone is going to be muted so that we don't have any noise interruptions. If you have any questions, please feel free to enter them in the chat function, which is at the bottom of your screen. As a reminder, we can see everything you write, so please don't put personal information or personal health information, because then you're telling everybody your business. So with that in mind, it's my pleasure to introduce Dr. Wynne Armand. She is the Associate Director of the MGH Center for the Environment and Health. She is an assistant professor at Harvard Medical School and a physician in the Division of Internal Medicine at MGH. Prior to coming here, she received her medical degree at the University of California at San Francisco, where she also received her residency training in a program focused on providing care to the underserved. Dr. Armand practices primary care at MGH Chelsea Health Center, and she serves as a faculty editor for primary care for the Primary Care Office Insight, or PCOI, which we all use as the providers here. It's wonderful. A knowledge resource that guides day-to-day clinical practice for primary care teams at MGH and across Mass General Brigham. So with that, I'll pass things over to Dr. Armand.
Thank you so much. Thanks for the introduction, and thank you for inviting me to join you for your town hall. And I thank you, all the attendees, for taking the time out of your day to also come to this. I thought I'd start by just asking for those that are interested to drop into the chat what concerns you, what brings you here today. I'm curious what your questions are. So if you want to just take, the next 30 seconds, if you want to, and I'll take a pause, and I'd love to see how much we can address today. And while you're doing that, I'm just going to try to share my screen. Okay. I don't see anything in the chat, but okay, thank you. Well, I know that guy. So let's get started, and I'll try as best I can to kind of keep my eye there as well. So I'm going to spend about 30 minutes talking, or 25 minutes talking to you about climate change. And my intentions for the next few minutes are to talk to you about how climate change affects health, and then because of the work that I'm doing, how the healthcare system contributes to climate change. And I'd love to share briefly with you a word or two about what Mass General and Mass General Brigham are trying to do about it. And then focus a little bit, have a conversation on what you can do as individuals. So before we talk about climate change, I'd like to start by acknowledging the enormous amount of progress that we have seen in the last 200 years. And really in the last 60 years. So if you can see my mouse, the inflection point where we see a lot of change is really around like 1960. So really the last 60 years. So this is a testament really to your generation and your legacy. We see so many more people that have achieved basic education, that have literacy, fewer people living in poverty, and better healthcare, as represented by improved vaccination rates and decreased child mortality. So, and this is in the presence of a world population that has increased by more than sevenfold in the last 200 years. Now, that kind of progress is accompanied by industrialization and use of our natural resources. So with that, we've seen climate change. And the last 9 years have been the hottest on record, with 2000, I think 16 and 20 being tied for the hottest ever since record keeping began. So how does climate change affect health? Before I talk about how it affects human health, I do want to acknowledge the concept of planetary health and One Health, where the animals, the plants, the environment, and humans are very much interconnected. And when something happens, there's a lot of downstream effects, some of it which is expected, some of it which is unexpected, and some which is probably unknown to us. The other concept I'd like to just mention before we talk about human health is that this is a global issue, but every individual and every community will experience this differently. Some of it relates to geography, where the individual lives. Some of it is related to government stability. Some of it is related to the healthcare system's infrastructure, as well as the individual's socioeconomic status and demographics and other health issues. So with that in mind, let's talk about how climate change affects health. So this is a kind of a busy slide, which I'll just briefly walk you through. Climate change does have a number of climate change is the warming of the temperature on the Earth, but with that, we see other things, other phenomena. So we see extreme weather events, rising sea levels, and in addition, you'll see a comment in there about pollution, which we'll also talk about shortly. And as I mentioned earlier, alluded to that what the experience of climate change is really a threat multiplier. And so what I mean by that is the people who are most vulnerable are going to experience climate change in a greater fashion. So we can talk about the effects of climate change as it relates to the impact on organ systems. It really can affect every single organ system. Or we can talk about it through exposure pathways, which is what this slide has. So walking through this, extreme weather events, those are the hurricanes, the flooding, the droughts, a lot of downstream effects. They're not just trauma, but also mental health effects and loss of housing, which then further compounds health impacts of chronic conditions. Heat can cause a number of issues, increased mortality, cardiovascular effects, mental health effects. We do see more suicide and aggression and violence during heat waves. Poor air quality. So we'll talk about pollution, but I'll also mention the pollen, which we're seeing right now. With climate change, there is longer pollen season and more intense pollen season, which can further exacerbate lung conditions. And so the water quality, part of that is the flooding. So with flooding, we can see our water system being contaminated, and along with that, gastrointestinal infections. And then between the floods and the droughts, this is and wildfires, we see our crops being affected. And not just that, with rising CO2 in the air, the nutrients and within crops are not as good. So the plants that have higher CO2, they show decreased protein and zinc and other kind of essential nutrients. And then with climate change, with increased heat, but also loss of habitat for animals, we see an evolving distribution of animals, and thus that what we call vector borne illnesses. So some examples of vectors are ticks and mosquitoes. And so we are seeing an evolving pattern of diseases, and one which we're familiar with in the Northeast is tick-borne diseases like Lyme disease. And then lastly, climate change is causing a lot of forced migration, which has got clearly affecting some areas more than others, but really is a global burden. And as I mentioned earlier, I said, air pollution is a little bit separate in the sense that it's not technically climate change, but they go hand in hand. So what is driving climate change? It's fossil fuel combustion. What's driving our air pollution? Fossil fuel combustion. And in high temperatures, we see worse air quality, worse pollution, increased ground level ozone. And air pollution is something that affects health both acutely, meaning short-term exposure, as well as chronic long-term exposure. And depending on an individual's health and age, their experience of air pollution will be different. We're seeing links with preterm birth, low birth weight, decreased IQ in children, asthma, stroke, cardiovascular disease, lung cancer, dementia. And there was a recent paper that estimated that just from fossil fuel combustion alone, it's responsible for about 9 million premature deaths in 1 year globally. That's about roughly a fifth of global mortality. And so reducing pollution is really important, not just for climate change, but also for health, direct health benefits. And those benefits we see real time on a faster level. And then climate change also impacts healthcare delivery, which of course then affects health outcomes. It's estimated that along the coast, East Coast, Atlantic Coast, and Gulf Coast, that roughly a half of areas will be affected with flooding in their hospitals by a Category 1 storm. And then 2/3 will be affected if we get to a Category 3 storm. And on the top right, that's Norwood Hospital from 2020. The flooding in that hospital is still closed. The bottom left, some of you may remember that Superstorm Sandy closed NYU's hospital. They had to evacuate the whole hospital. And then bottom right with Hurricane Maria, which devastated Puerto Rico in 2017, really had a lot of other implications too. It affected our supply chain because of a lot of manufacturing that goes on there. We, even in Boston, saw we had a shortage of intravenous fluids, IV bags. And how does healthcare contribute? So if you take healthcare and pile up everybody's healthcare system, it would be the fifth largest emitter if it were a country on this planet. And if you take the whole global healthcare sector, the US is responsible for 1/4 of that. 1/4 of the whole world's healthcare sector's emissions come from the US. So in the US, that's probably it's estimated that the emissions from our country, it's roughly 8 or 9% from our healthcare system. I do want to acknowledge that our GDP, the gross domestic product, is actually probably double that. So, it comes with a lot of money in this industry. But nonetheless, we should do our part to decrease our footprint. This is actually something that comes from the UK. The UK has a National Health Service, NHS. So they have been following their footprint for many years. And because they have a National Health Service, unlike our payer system, which is really divided, they're able to really see on a country level where their emissions are coming from. And just really briefly, the greenhouse gas protocol divides our emissions into 3 scopes. Scope 1 is direct emissions. So as a hospital, what are we directly putting into the environment? That would be our anesthetic gases. That would be our fleets that are fossil, that are operating on fuel combustion, that are cars or shuttles. Scope 2 is the electricity, the energy that we purchase. And scope 3 is really everything else. So we rely a lot on the supply chain. The US doesn't have as robust data because of the reasons I mentioned, but this article from the last year is an estimate of the US healthcare systems breakdown. And again, you'll see the darker blue is scope 3. So a lot of it is our supply chain, but you'll see the largest line item here is pharmaceuticals. That's about 20%. So what is Mass General doing about it? So I am grateful to be a part of the Center for the Environment and Health. That was inaugurated 2 years ago, but Mass General has actually been paying attention to this long before that. It has recognized the need to decrease our energy consumption even decades ago. And so in 2008, Mass General set a goal to reduce our energy consumption by 25% before 2020. But instead of 12 years, we accomplished that in 5 years. And in 2018, Mass General transitioned to have all of its electricity come from renewable sources. And in 2022, Mass General Brigham signed on to the Biden's health sector climate pledge, which is the intent to reduce our emissions by 50% by 2030 and be net zero by 2050. Just a word about our center at the Center for the Environment and Health, where our mission is really guided by 4 pillars. We work to try to provide healthcare in an environmentally friendly way. Our second pillar is to try to foster research in this area. Our third pillar is to try to educate our patients, our staff, and a broader community about these issues. And our fourth pillar is to try to advocate for healthier environments, especially for communities that have been disproportionately affected by climate change and pollution. So we are a small group, but we work with leaders across the hospital, as well as leaders in non-clinical departments to try to achieve this work. And I'm just going to mention briefly the Cambridge Street project, because I feel like I suspect as patients, that's something that you've noticed, all the construction going on. This will be our most energy efficient, sustainable, greenest building. It's gone through a lot of redesign to try to decrease its environmental footprint. But also, along with that, it's really tried to recognize the importance of resiliency. So not just in the face of climate change, climate disasters, but also other types of biohazard, for example, or other types of catastrophes. It's built to withstand and be really an island to support and house everybody, including the patients, for a 96-hour window. So moving on to what you can do. I think I've tried to break it down into six steps, and we'll talk about each one. I would say, number one, plan for electrification. I think it's not always easy to make changes in your household, but I think sometimes there are barriers to being able to do that. But I think looking into that now allows one to say something breaks down, the HVAC system breaks down, and you're in a bind. If you've done the homework and you've planned, it makes that transition easier. The renewable energy sources for our electricity is really skyrocketing. So by 2030, it's projected that 80 to 90% of our energy can come from renewable sources. So planning for electrification now means the transition to renewable energy as more progress is made in this technology. Favoring active transportation. So as we discussed, a lot of pollution has direct health harms. And so driving less, especially if you have a fuel combustion vehicle, combines also with getting more exercise. So that's something we call co-benefits, things that help both the environment as well as the individual. And along with that, I would say adopt plant-forward eating. So again, having a heavy plant-based diet is better for health and much better for the environment. Number 4, find your people. This is kind of what I'm talking about, this town hall. It's a way to build community. And I think the stress and the concern and the worry that we have is so much easier when we have a community to share, to work together, to build resilience. Number 5 is talk about it. And I think that oftentimes people feel like as an individual, we can't accomplish a whole lot. But I think that's arguable. But on top of that, talking about it, you really, you double your impact. And if that person goes on to talk about it with somebody and so forth and so forth, and along the way, along that chain of communication, there could be somebody who is in a power position to make some dramatic changes. I like the example of, say, the person that plans the public school menus, or the person that is a city planner that plans out the pedestrian walkways and the bike lanes. And the last thing I have on here is work to your level of discomfort. I think that it can be daunting, and it feels like these little changes may not make a big difference, or they're too hard to do. And what one person can accomplish may not be what another person can. So I think a nice level to target is something that feels like it's challenging and a little uncomfortable, but manageable and not stressful. This is an adaptation of a paper from 2017 estimating what impact personal choices have in reducing carbon emissions. I think many people are very focused on the things up here. So LED bulbs, recycling, as you can see, that's much lower impact. Not to say that one shouldn't do it, but really, if you go down to the bottom, that's where most of our emissions are coming from an individual level. So we had talked about trying to drive less, living car-free. You can see it's the biggest one here in terms of reducing emissions. Reducing by one transatlantic flight will also, just in 1 year, reduces carbon emissions by a lot over this year in terms of, you look at the footprint. And then we talked about renewable energy and plant-based diet, which is up here as well. This slide is just to really emphasize the busy slide, but I think what I'm trying to emphasize here is that some of the changes that we talked about, the effect on climate change does take time, but there's a lot of effect that helps the individual now and your community now. And so again, the co-benefits. And so I think that it's some of these changes have powerful impact here and now. This is just to kind of go back to the plant-free diet. The Economist took a study, and they kind of played with the graphs a little to make it, and I think, a really fun and interesting way of showing this information. So on the first graph, if you have the risk of dying here on the x-axis down here at the bottom, people who eat more vegetables and nuts compared to people who eat a diet high in processed red meat, you can see that the risk of dying from disease, poor health outcomes is much lower if you're eating fruits and vegetables, and much higher if you're eating red meat. The y-axis, this here, the taller, the higher it up there, is a greater environmental impact. And you can see the two biggest environmental impact here is unprocessed red meat and processed red meat. Seen another way, the graph on the right from a different study looked at, based on a 2,300 calorie diet over the course of a year, what is the average emissions versus somebody with an average diet in the US versus a vegan diet down at the bottom. And you can see the difference. But, even eating 2/3 vegan and 1/3 eating some meat, you can see that's a pretty dramatic drop there. So it doesn't mean that everybody has to eat vegan, but I think just paying attention, even just reducing the amount, has a little impact as well. And this is from Our World in Data, and they actually have a lot of interesting graphs if you want more information. This one, this is looking at over 30,000 farms in over 100 countries, and they take the most sustainable farms and the least sustainable. You can look at the amount of carbon emissions, greenhouse gas emissions from beef versus down here at the bottom, nuts. So you can see even like the most sustainable beef is still much worse than the most unsustainable nuts. The height of this is the amount of farms that are represented there, and then the white dot is the median. And so this is to go back to, I can't remember what point, maybe point 5, about talking about it and multiplying your impact. As a primary care physician, I was really happy to see that, we were kind of on the upper, we were one of the more trusted sources for information about global warming. But in the red, you'll see family and friends for almost every category really beat the primary care physician. So your voice does matter. So again, these are the 6 things that I just outlined. And on the right here is from the American College of Lifestyle Medicine. And I feel like they overlap quite a bit. We talked about healthy eating. We talked about increasing physical activity with co-benefits of active transportation. We talked about finding your people, talking about it, the importance of community and relationships. So, a lot of this action just goes along with having a healthy lifestyle. And I wanted to just end by sharing some resources. We mentioned PCOI earlier, and PCOI is accessible to you through Patient Gateway if you have that. It's also accessible through EPIC, which is our electronic medical record. We're trying to build out our climate environmental resources section. It's a work in progress, but you can find some information there. And as a clinician, if you wanted to, we have one on, for example, pollution, that can be attached to Patient Gateway messages or attached to an after visit summary. If you want, I added some resources here. Mass General Center for the Environment, I have at the top only because that's the center that I'm representing, but also in our resources section, we have all of this and more. I just couldn't fit it on one page. So we do have a PDF link that has resources both on a regional as well as a national level, resources related to mental health and climate change, resources related to advocacy, healthcare effects of climate change. The one I would just point out here is the third act, because that one, I don't know if you're familiar with Bill McGibbon, but he is very well respected in his work related to climate change. He started the group 350.org, and he recently started the third act, and that's referring to like kind of his phase in life, like having gone through and being a senior citizen, the third act of life, feeling like, oh, how do we make an impact? And so this group is focused for folks over 60, but I don't think it's a requirement. And so you can certainly look there. Some of these other resources on here are more local. And then at the bottom here is if you're interested in calculating your own footprint, the EPA has a few websites where you can do that. So I'm going to stop sharing my screen and welcome a conversation. So let me see. Here we go.
So if people have questions, feel free to enter them into the chat function. I'm formulating about 17 questions right now, so I think one of the questions that I have is, so much of this, when I was a child, we had Woodsy the Owl, give a hoot, don't pollute. And we had the Crying Native American commercial looking at the wasteland of the modern American city. Over the years, it's become obviously a very political, unfortunately, like a lot of things that are really important, they become very political. And can you say a little bit more about the relationship with the primary care doctor? Because this is something that I feel like I could be an advocate now as somebody who generally tries to avoid engaging in a lot of political talk. So I don't want to alienate any of my patients who might have different views.
Mm-hmm. Yeah, I think that is something that comes up a lot. I don't hesitate to bring up climate change when I think it's relevant for a patient's health. I don't bring it into the conversation just randomly, but if I have a patient who has bad allergies and is asking why are my allergies so bad this year, or I've never had allergies before, I think they have a right to know, like, this is why it's happening. This is how you can protect yourself. And the same thing with pollution. Talking about really, like, we've known for years the devastating effects of pollution, but it's really been under discussed. The amount that it contributes to cardiovascular disease and respiratory disease. And so, I think if you live in an area that's heavily polluted, you live in a place that has a lot of industrial, buildings, or you live near the freeway, there are some things you can't do, but some things that people can do, not checking the air quality. A lot of the weather apps now have the air quality prediction. And so you can go to airnow.gov and put in your zip code, and you can get alerts for poor air quality. So I think that I don't pass judgment politically at all, but I think it's so relevant for public health and health. So I think that I personally don't have any issues speaking about it from that aspect.
And I'll just, before we go to the next question, I'll just say as a primary care geriatrician, I worry about instances of extreme heat, where our patients are particularly prone to isolation, dysregulation of temperature awareness, dehydration, and hospitalization. So it is especially near and dear to a geriatrician's heart that our environment be temperate. Similarly, issues around hurricanes and extreme blizzards, where people have mobility issues, so this is really a very front and center topic for us.
Mm-hmm.
I noticed that there's Michelle Seligson says, food choices are very difficult for elders since protein is very important, and many people would find it difficult to combine foods in order to get enough protein. Can you speak to some of the logistical and financial challenges of eating a more environmentally conscious diet?
Mm-hmm. Yeah. The US consumes 10 times more meat than the rest of the world. So in general, for most Americans, like, they are over proteined in their diet. But I think it is an important point. There are really great sources of protein that aren't from meat. So I'm just trying to think of off the top of my head, like, I know Practice Green Health has an infographic with the different protein content of nuts. So, for example, lentils not just nuts, but also beans and other legumes. If you go to that website, but I suspect there are probably other ones as well. There's also obviously other seafoods, which if you look at that slide with if you want to talk about a sustainable diet, seafoods is lower on the impact scale there. So things like tofu, nuts, beans have a pretty good amount of protein. And then if you want some sort of non-plant-based protein, seafood, poultry is also less impactful. The worst ones are, beef and lamb.
Sorry about the Easter lamb, folks. We're going to have a tofurkey. Excellent. Are there other questions that folks have? Feel free to enter them in the chat function. I'm monitoring it. So what I heard is that there are a lot of resources that you put up in your references section, where people can go and explore this a little bit more, including dietary input. So we
don't have the dietary information on there. The one I was thinking about was Practice Green Health. If you go to the World and Data, they do have, I think, different amounts of greenhouse gas emissions depending on the source of protein, which I showed you in terms of all foods, but then they have a separate one for just milk substitutes and vegetables, I think. But our resources are more focused on, we have a page that has links to, if you want to be more active in your environment related to work on climate change or educate yourself more about climate change, not so much the nutrition part.
Excellent.
So I see a question about recycling from Judy. Yeah, so recycling is really painful to talk about because I feel like it's such a, it's such a, people want to recycle, and it's good that we try. The problem is that most of the recycling what we put into the recycling containers isn't recycled. The vast majority isn't. And part of it is that there's a lot of restrictions on what can go into recycling. And it's so hard to understand what can go into recycling in our state. And so with single streams recycling, putting everything in the same bucket a lot, and there's contamination. So a lot of it is thrown out. We don't have a place to give recycling since, China stopped taking our waste, our recycling many years ago. So you have a lot of recycling that's either thrown out because it's contaminated or just not picked up because there aren't any resources. Not to say we shouldn't try, but the other thing I would really try to emphasize is more upstream instead of downstream efforts. So really trying to reduce our consumption and waste or consume in a different way. So really thinking about, bringing maybe our containers to get the takeout instead of using their reusable container, or not buying as much and gifting things that, like, I'm just thinking about probably grandkids, all their birthday parties. They probably have all these plastic toys that end up in landfill, but really, thinking about before creating the waste and then trying to, instead of thinking about what to do with the waste, trying to not create the waste is probably more important.
I see a question about taste buds and dietary change.
That's a good question. I don't know. I guess it's a personal preference. I think, taste buds do adapt, just like when we talk about low salt diet. Most people at first feels like the food is very bland, but then they quickly adapt. So I'm not sure that's the same case, but I would expect that would be the same case if you're transitioning away from meat. And there are a lot of other ways to spice up your vegetables and beans that don't include salt that that could make it more tasteful. So the gas and induction electric, so that's a very good question. And I didn't actually bring that up, but I expect that many of you have heard this in the news over the last few months. So gas stoves, ideally, if you can transition away from them, would be better. Not everybody can do that. I'll say that if you can, you should check out Mass Save. I think it's masssave.gov, because there are rebates up to like $500 maybe for induction stoves. So, but, and I think when it makes sense and you have the resources, or your gas stove breaks down, I think that would be a good transition to induction stove, as long as you don't have a pacemaker or an insulin pump, because it does have some magnetic qualities. The other thing I would say is that if you do have a gas stove and you can't transition, then there are a lot of ways to work around that. So using an electric kettle to boil instead of boiling your water, using a microwave, especially when it's hot, using an air fryer type of thing. So one, you're using electricity instead of the gas stove, and you have less heat in your home. And the reason why it matters is that the gas stoves are associated with mostly with childhood asthma. The nitrogen dioxide has been associated with the development of asthma, and the higher concentration of nitrogen dioxide in the home is associated with increased wheezing. And it may also have some impact on people with COPD, with exacerbations. So that's one thing. So the gas stove creates not just nitrogen dioxide, but also a lot more PM 2.5, the particulate matter 2.5, which is the bulk of the soot and pollution that we're talking about. So that's happening in the home with the gas stoves. The other thing is that it leaks methane. So even when it's off, it may be leaking. Actually, most are leaking methane. There was a few studies in the past year that showed this. So methane is a potent greenhouse gas. Methane also combined with nitrogen dioxide creates ozone. So it's bad on many levels. So not just it's leaking when it's off. It contributes to greenhouse gases, climate change. It causes more pollution, indoor pollution. And of course, if you have a vent, it's just venting it outside. So I was going to say something else about this. It escapes me. But so if you do have a gas stove, I would just open your windows when you're cooking, use the vent, your ventilation hood, make sure it's a hood that actually vents outdoors instead of circulating around. If you can get an air purifier, that probably makes a little bit of difference. It does make a little bit of difference.
Dr. Armand, you were talked about co-benefits. As a geriatric physician, I'll often have patients who have gas stoves and also might have some short-term memory problems. So we will often recommend they transition to using an electric kettle that has an automatic turn off, and also using the microwave, just because people can sometimes forget and cause burning of pots and pans, and obviously the fire hazard. So this would be one of those sort of co-benefits. I notice we have one more question about, do you have any thoughts about meat substitutes?
So now I personally like them. Not everybody does. I do like the Impossible Burger. But I think it's a couple things. I mean, it's all a spectrum. Like nothing is perfect. Ideally, Whole Foods is better, but that doesn't always make sense for people. And I think it's another industry, right? Now these meat substitutes become another industry. They have maybe more saturated fat and salt than you may want. So I think it's a balance and it's a trade-off of like what makes sense for your own health and what you're able to afford and what you're able to cook. From a climate change perspective, certainly the meat substitutes are better, though obviously there's all these issues with industrialization and packaging and transport too. But that being said, it's still much lower impact than red meat. I would say just making sure, obviously it has to taste good because you want to enjoy your food. And then I would say also just looking at the packaging, like making sure, looking at ones that have less saturated fat and sodium, if that's probably an important thing to pay attention to for most people.
Excellent. Well, I just want to thank you so much. This was really a very enlightening talk. And I'm sure I speak for all of us to say thank you so much. Give you a round of applause. And
thank you. Thank you for inviting me.
Thanks. We'll just transition in the time we have left just to address some of the concerns about COVID, the house guest that will never leave. And first thing is that our public health emergency on a federal and state level has ended. And what that has meant is that the universal masking policies for hospitals have also gone away. When you come to see us in the office, there are masking stations available for you with hand hygiene stations as well. You certainly can ask your provider if you feel comfortable wearing a mask. No one can require anyone to wear a mask at this point, but certainly most of us in geriatrics will do whatever our patients tell us to do because we're pushovers. So that would just be something I would just want to make you all aware of. The second thing is there has been a new recommendation for a second round of the bivalent mRNA vaccine booster for COVID. So many of us have received, if we had the two shots, and a booster, most of us have received 5 injections. If you are over 65 or immunocompromised, you may now receive a 6th, which will be the same as the booster you got. It might be slightly updated. So I just want to let you know then that is something you can reach out to your local pharmacy where you get your vaccines, and they'll be able to set you up with an appointment. There is on the horizon testing going on around the respiratory syncytial virus vaccine. So Medicare will pay for the new booster. That is covered by insurance, or your insurance will cover it. What the public health emergency was covering was the sort of the free access to a certain number of COVID tests. Those are the things that now we all have to pay for. So generally speaking, you can receive a booster after a couple of months of having had COVID. So it's not something you would get right away because you have some level of immunity to it, but some months later you should be okay. So the respiratory syncytial virus, many of you have heard of that as RSV, which is often more concerning in children because it can impede airflow through their airways. But we've also found that this virus can be a pretty nasty one for older adults as well, especially people who have underlying lung problems like emphysema or asthma. So there are studies underway around making this vaccine available. So we'll have to stay tuned as that makes its way through. All right. So we can end a little bit early today. It's been wonderful to see you all. As a reminder, if you have any town hall ideas, please feel free to email us. Email Monique. She'll put her email in this, and we're happy to engage. This idea came from our Connections Clinic, and it was an absolutely delightful idea. And I know one thing we were looking at was toying around with talking about steps to aging successfully. What do I need to consider in terms of home, finance, planning, etc.? And that will be coming up hopefully in the next few months. Most likely we'll have a town hall every month. We may take one of the months off in the summertime if we just can't get all of us, if we're all on, one of us is on vacation, but we'll do our best to keep these going during the summer as well. So with that, I'll say go out and enjoy the beautiful spring that's slightly cold, but getting warmer. Take care, everyone. Thank you. And thank you, Dr. Armand.